Okay, hi everybody. Welcome to our meeting. My name is Melanie Jones, and I am with the Health Education Department with the Lake Cumberland District Health Department. And today I have with me Amy Tomlinson, our Executive Director, Dr. Wayman, our Medical Director, Stuart Spillman, our Environmental Health Director, Laura Woodrum, our Director of Nursing, and Brian, who is with the Technology Department. And so COVID-19 numbers are increasing across Kentucky and Lake Cumberland. And so to better serve our citizens across the district, we've decided to reinstate the YouTube live information meetings bi-weekly. And so I do want to remind everyone that they can continue to find our COVID-19 data on our website at lcdhd.org. And beginning this week, we're also starting our public information reports, and they will be Monday through Friday. And we won't be doing those on the weekend. So to start us off, Amy Tomlinson will be sharing an overview of COVID-19 data across our 10 counties.
Thank you, Melanie. My name is Amy Tomlinson, as she said, and I'm the new Executive Director for Lake Cumberland District Health Department. I guess I should give you a little bit of background about myself maybe before we get into this. I have been with the Health Department for 17 years, and I have been fully active with the COVID response from day one across the counties. So although I'm new to these media briefs in some ways, I'm not new to the Health Department or to this response. So I just want to share with you all my screen just for a moment. Give me just a second here to get my data ready for you. These are the latest numbers or case summaries as of last night. You can see that the active cases, the first column there, the active cases by county. I'll read them off, but it's much easier for me, if I have something to follow along. So I wanted to share my screen so you can visually see this as well. Adair County, we report 52 active cases for the county. Casey has 25 active cases, Clinton 18, Cumberland 6, Greene 36, McCreary 50, Pulaski 179, Russell 31, Taylor 49, and Wayne 22. And that's for a district total of 468 active cases as of last night. The next column there is hospitalized numbers. So you can see those. We have 27 total hospitalized individuals that we are aware of across our 10 counties, and they're spread out, 1 in Casey, 1 in Greene, 1 in McCreary, 18 in Pulaski, 3 Taylor, and 3 Wayne. And that doesn't necessarily mean that that person, for instance, the 1 in Casey, they may not be at the Casey County Hospital. They're just hospitalized somewhere. It's a Casey County resident that it would be hospitalized. And then you can see the others. The next column is self-isolation. Those are the ones who are just an active case, but they're isolating at home. So you can see these numbers across for the 10 counties and for the district. Our total cases as of, all cases to date for the COVID response is now up to 23,958 across our 10 counties. I'm also going to share with you, let me switch here just for a second and share with you some data from our webpage in case you haven't taken an opportunity to look at that. This is a very good visual of where we are. So this is the website that Melanie mentioned at the beginning, and you can get here by going to www.lcdhd.org and then clicking on the COVID banner that comes up on the homepage. And all of this data is here. And you can see this is the COVID information over the course of since last March of 2020 is where this starts, this trend line. The green line is our district numbers, and the yellow line is the Kentucky numbers. So the thing that I wanted to point out to you is how over the past month or so, our numbers, these green numbers, have gone up. And you can see we are now at like 23.17. That's the rate of the positive cases across the district. And you can see that the state is at 16.22 in comparison. So we're actually a little higher than the state numbers at this point in time. You can also, if you're interested, you can sort this and look at your county specifically, if that interests you, and see how your county's comparing against others. The other thing I'm going to point out here is I'm sorry for the scrolling. That may make some people motion sick. If you'll scroll down on the page, there's lots of data and information here. This chart is one that we keep up with locally. It mirrors very closely the state chart that you all may be aware of that the governor talks about sometimes on his briefs. This information is day-to-day changes, and sometimes there's a delay in the report getting to the state reporting cases and numbers for us. So our color coding and our numbers may be slightly off compared to the state, but it should be very similar and very close. So we have, as of last night, 7 of our 10 counties in the red zone, which is the critical spread of transmission, and that's 25 cases per 100,000. If you hover over the counties, for instance, it'll tell you what exactly that rate is for that county. 3 of our counties are still in the orange, and they have a slightly lower rate of transmission that's called accelerated spread, and that's anywhere from 10 to 25 cases per 100,000. So you can hover over and see that Cumberland, Wayne, and McCreary are our orange counties, and the rest of our 10 counties are now considered in the red zone. Let me stop share just for a second. Okay, I crunched a few numbers this morning in preparation for the discussion with you all today, and I wanted you all to know that I looked at the numbers of cases reported for the month of June, as well as the numbers of cases in July, and then already for August. And we've only had 2 days worth of reporting for August, so that's just Monday and Tuesday. We don't have today's numbers yet figured into this, but every one of our counties, except one, we had 9 out of our 10 counties that at least doubled their cases from June to July. Cumberland was the only county who kind of held the same and didn't double. The rest of them at least doubled. Some of them tripled, some of them quadrupled. It was a very big month of July. That was a very big month of case reporting for us. So just wanted to share that with you all. And that's kind of the situation at the moment. We have had several questions, are starting to get a lot of requests for information from partners and media across the 10 counties. So we felt that this information sharing method would be the best moving forward so that we can gather those up and answer those for you all in a timely manner. So we hope that you find it beneficial, and thank you for tuning in.
Also, if you have a question that you would like to ask, you can put it in the chat box on the YouTube page. So the first question is for Dr. Wayman. Do people need to get a booster with the Johnson & Johnson vaccine?
So at the present time, the FDA has not authorized any booster doses from any vaccine. The Pfizer company has submitted a question to the FDA for authorization, but we have no results as yet.
The next question is also for you, Dr. Wayman. What are the quarantine guidelines for people who have been vaccinated?
So vaccinated people have been exempted from quarantine. However, the CDC has recommended that exposed vaccinated people get tested for COVID on day 3 or 4 or 5, as there have been breakthrough infections in vaccinated people. Currently, it's approximately 12%. The Delta variant is very transmissible, and thus it seems, because of the fact that many more viral particles are found in the nasopharynx of the individuals who have Delta variant, there's a big load of virus that's being expelled and seems to be catching a lot of people. Unvaccinated people must quarantine for 10 days or get a test on day 5, 6, or 7, And if this is negative, they can be released on day 8.
Okay. The next question is for Stuart. For a recovery facility, are there any true guidelines for our recovery program?
So guidelines had been relaxed, as we all know. And right now, there's only recommendations. Those recommendations are to mask, especially unvaccinated people need to mask, and also to maintain social distancing. As far as cleaning goes, to continue to sanitize all the high-touch surfaces.
Okay. The next question is for Dr. Wayman. Because of many interpretations of the effectiveness of the vaccines, is one vaccine more effective than the other?
So all the vaccines are about 95 to 97% effective against developing severe disease. They are all approximately 65% effective against infection with the Delta variant. 95% of people in the hospital currently are unvaccinated. These are real world numbers. So it doesn't really matter which vaccine you get, you should just get vaccinated.
Okay. The next question is for Amy. Is there anyone in McCreary County that offers the Pfizer vaccine?
Okay. I'm going to give you a couple of websites that you can look for that information. It changes daily on what allocations people have, what shipments arrived on what days, and things like that. So the best ways to find that information out is to go to the kycovid19.gov page that's through the Kentucky Department for Public Health. And you can find vaccine information there, vaccine availability information. There's also a website called vaccines.com where you can search by your zip code or by the vaccine type of what you're looking for. And it should give you lists of retail providers and providers in general that would have those vaccines that you could find. The health departments across our 10 counties have requested Pfizer vaccine from the state and should be receiving that shipment this week. And we'll be dividing that out. So all of our local health departments should have a small amount of Pfizer vaccine available. And that is the vaccine that is 12 years old and up and eligible for 12-year-olds and children. So if you're looking for a vaccine specifically for your kids to get them ready to go back to school, you can call your health departments or look at those websites that I mentioned and see if the vaccine that you need is available there.
Okay. The next question is for Dr. Wayman. If I'm vaccinated and come into contact with a positive COVID case, what do I need to do? Also, am I correct in reading the guidance that 10 days without symptoms, you can return with a mask, or 7 days return if been tested negative within 48 hours of returning?
So if you have been vaccinated and exposed, and you remain asymptomatic, you do not need to quarantine. The CDC does recommend that you get tested on day 3, 4, or 5, as there have been breakthrough infections, but that you do not have to quarantine.
Okay. The next question is for Laura. Are quarantine and release letters still being provided by the health department?
When we identify a positive case of COVID, we make that initial call to the patient and educate them on the front end of what parameters need to be met for them to be released back into the general public. If they need a release letter, we'll issue it on that day and give them that forward date. So yes, we are. We aren't issuing quarantine letters to contacts that are outside of the positive cases household.
Okay. And the next question is also for you, and you did touch on this. Will people be required to have a release letter from the health department to return to work?
We don't require that from the health department, but we can provide that for positive cases. But maybe some employers need that, and if so, they just need to let us know so we can provide that to them.
Okay, and then the next question is also for you. To get a second Moderna vaccine in Russell County, do I need to make an appointment, or can I just walk in during regular business hours?
Okay, you can give our local health departments a call and see if they're giving vaccines on that particular day, and they can set you up an appointment to come in and get a vaccine.
Okay, and then the next question is for Amy, and it is asking where Pulaski stands in the COVID numbers, their positive rate. The CDC is showing something different. Why is there a difference?
Okay, and we talked about this at the beginning just a little bit. I showed you the maps and the data that we have, and I mentioned that that our data, our local data, is usually the most accurate because we report our cases daily. Some of the other reporting sites may update daily or every couple of days or weekly, or I'm not certain on the frequency of how that's reported always. And the fact that we have to report then our numbers to the state and to the federal, there's just a lag sometimes in the communication between those agencies. So our local information on our webpage is generally always the closest to real-time data that we can offer. Nothing will ever truly be real-time because it's just impossible with as fast as this is happening. But ours are at least updated daily, and that's where I would refer people. The state or the local web pages for the health department.
Okay, and then the next question is also for you, Amy. Is there anywhere in Somerset to get a rapid COVID test? Is the health department offering rapid COVID tests?
Okay, there are many providers across the district and across Pulaski County. I think that was the specific question, that are doing testing still. It's generally by appointment and may require an office visit. It's not as readily available as it was at one point in time when you could just do drive-through testing somewhere and that kind of situation during the height of all of this. So it's a little more inconvenient in some ways, but it is still readily available. The health department is not doing testing. We've kind of monitored that across our counties, and we never felt that that was a need that we needed to provide, a service we needed to provide. We felt that that was available with other providers and other community partners. So rather than compete, I guess, for services and that kind of thing, we focused on the parts that were specifically assigned to us, such as the case and contact investigation and working up the cases and getting the quarantines and those kinds of things in a timely manner. So we are not currently doing the testing, but there are plenty of providers across the counties that are.
Okay, thank you. And then the next question is also for you, and we did touch on this earlier, but is the LCDHD considering returning to daily reports?
We are, and we have since about the first or the middle of last week. I haven't broadcast it widely because we're trying to train some additional staff on how to do the reports, the daily reports. We have kind of switched a formatting program and some different things. So we are working out the kinks and the bugs out of the system to make sure everything is working correctly and as it should. So the best thing I can tell you is it is our every effort to get this information updated nightly. It may be very late in the night, as it was during the height of COVID last year. Some nights it was 11 or 12 o'clock, at midnight before all the cases got finished and updated and people had time to get their reports done and all of that. So be patient with us. What I would recommend is checking our webpage or our social media sites by noon the following day. So for instance, tonight I will work on these reports for today. And my goal is to have that information out and available to the public no later than noon tomorrow. So by noon on August the 5th, you should have access to the data for August the 4th. And that is very close to real time. We would not have any further updates, that we could do at that point in time until tomorrow evening. So that's still within 24 hours of us getting the reports in and finalized and all of that.
Okay. The next question is for Dr. Wayman. We've heard and read in places that if you've been vaccinated and get the Delta variant, you cannot spread it to others and do not have to quarantine. Is that true?
So yes, if you've been vaccinated, you do not have to quarantine. But because the Delta variant seems to be much more transmissible, you should still continue to wear a mask. And if you can get tested on day 3, 4, or 5, and you find that you are positive, then you would have to isolate.
Okay. And then the next question is also for you, Dr. Wayman. Specifically, what about the Delta variant is leading to the breakthrough cases in vaccinated people?
So it seems to be the huge viral load, that is the number of viral particles that the Delta variant seems to leave people with. So we know that the previous variant, if one person was infected, they could then infect maybe 2 others. With the Delta variant, one person can infect 10 others. That is much more transmissible. We think it's the antibody system, which is the first line of attack, is overwhelmed by the number of viral particles. So even though the initial immune system is not coping, it does decrease the number of viruses. Those that get through will be attacked by the T cells, which were primed by the vaccine, making the illness much milder. With the Delta variant, we are seeing 1,000 times more viruses in the respiratory tract, and we think this is part of the problem.
Okay. And then are the infection symptoms the same as in the earlier COVID cases, Dr. Wayman?
Yes, they are mostly the same. So people get a sore throat, cough, loss of taste or smell, body aches, difficulty breathing, fever, nausea, diarrhea. Nasal congestion and runny nose may be more prominent with the Delta variant, and also with people who've been vaccinated.
Okay, thank you. The next question is for Dr. Wayman or Laura. When do you think a booster vaccine will be available for those who took the shot several months ago? Do you think a booster is needed? Is the health department preparing to offer those?
So there's been lots and lots of talk about booster doses, especially for older people and those that may be immunocompromised. However, as yet, the FDA has not approved or authorized a 3rd dose. This is in the works, so I don't know when this may happen. It may be later this year. Israel, for example, has already started giving a 3rd dose of Pfizer to people who are 60 and older. We know that the elderly do not mount as good an immune response as the young, and studies have shown that their antibody responses are lower. The higher the antibody response, the better you are protected. Currently, the vaccines are working very well against causing severe disease and hospitalization. But as the antibodies wane, since it's been around 6 months for some of us who've been vaccinated, I think booster doses will be approved at some point.
Okay, thank you. The next question is for Amy. Have there been any deaths in our area of anyone who has been fully vaccinated?
There is one death that I'm aware of that was in a fully vaccinated individual. That person was elderly and had other underlying comorbidities. And as Dr. Wayman mentioned, just the immune response may not have been as robust in that person as we would have hoped with the vaccination. But of all of our cases so far, the only one I'm aware of is that one individual.
Okay. The next question is for Dr. Wayman. Why are there so many breakthrough cases?
Well, one of them is a statistic thing, which is the more cases there are, the more likely people who are unvaccinated will become infected. As you remember, when the vaccines first came out, it did state that they were 95% effective, which means 5% not effective. The more cases you have, the bigger that number. I mean, not the percent, but the number of people.
Okay, thank you. And are we seeing breakthrough cases with all the vaccines?
Yes, we are. They are all equal in their negative part.
Okay. And then the last question is for Laura. How has the contact tracing changed? Are COVID cases not being called on their release date?
I touched on that earlier. We do all that education and give the positive cases that information when we do the initial call. We count out their 10 days from first symptoms onset, and tell them they can be released then. So we don't make a call on their release date.
Okay, thank you. That was all the questions that we received beforehand. Were there any questions on the YouTube chat?
I have a couple. I've been monitoring, Melanie, and it looks like one of them is, how are you testing for the Delta variant? And I know that I'll take a stab at this, and then Dr. Wayman, you tell me if I'm incorrect, but across our providers in our 10 counties, to my knowledge, none of them do the genotyping or the sequencing that is required to do that specific test. Some of our outbreaks that we're seeing that are in congregate settings and certain things may be sent to a state lab for testing. There are certain criteria that the state lab wants to see samples on, and they request those. And so we send samples off from time to time to the state lab, and they have that capability. There's only a handful of what they call sentinel labs across the state that do the specific genotype and the sequencing that is required for this. And none of those are in our region. So the best information that we have is from those, and we extrapolate out because it's in these other regions of the state. We then assume it's here. And then the CDC, of course, monitors that also. And the CDC information at this point in time is saying that up to 80% of the cases in Kentucky currently are most likely Delta variant. So that's where we get that information. It's an assumption at this point because we don't have the specific information on every single case, but it's the best information we have. And then a second question was, if you've had COVID previously and then are fully vaccinated, would you have more of a defense against the variant? Dr. Wayman, is that a question you can answer?
And any exposure of either through vaccine or illness boosts your immune response. So you will be better equipped to fight any variant. This variant is very susceptible to the vaccine. As we said, even though you can still get infected, and it may be because our antibody system has waned in the people that are getting infected. And yes, we have at least 80% and probably by now even more in the area of the Delta variant. So really there is no need to test specific people. We can just assume that's what they have. I don't know, did that answer the question? If you get COVID disease, you will mount an immune response. If you get vaccinated, you will mount an immune response. One before the other or the other way around, you will boost that immune response.
So both an exposure, the illness or the vaccine should trigger some sort of fight response in your body against this exposure. Okay. I see a question from, looks like Judge Anderson. Of Wayne County's 22 cases, do we know if those had previously been vaccinated? I know that that's a question that's starting to be asked on our questionnaire that we ask cases. I don't have those numbers specifically, Judge Anderson, broken out and readily available for this information brief. We calculate that across the district. I know every night in my report, that's one of the numbers that's listed there is the number of what we call breakthrough cases. And a breakthrough case is someone who has been fully vaccinated or has had both vaccines for the 2-dose regimen or the one for Johnson & Johnson, and then is 2 weeks post that last dose. So that information is available there district-wide across there, but I don't think it's broken out specifically by county. But I can look up that information and get in touch with you, Judge, for that. And I think that's all I see in the chat, in the YouTube chat. We can just give it another minute or two, I guess, and see if there's anything. Sometimes there's a lag on the two screens here, so. Thank you for moderating today for us, Melanie. I appreciate you stepping in.
You're welcome. I just want to, and while we're waiting, I want to encourage everyone to get vaccinated. That's what's going to help turn this pandemic around. To wear a mask, social distance, and sanitize your hands frequently. And then if our next meeting will be August the 18th at 2 o'clock Eastern Time, 1 o'clock Central Time. And then if you have a question to ask for the next meeting, if you think of one, you can send that through our website.
I'm not seeing any other questions, but before we dismiss, I guess, or we break this up, I will say about the breakthrough cases, as I mentioned earlier, and I think Dr. Wayman mentioned this in one of her answers, around 95 to 97% of our total cases, generally our active cases, are unvaccinated individuals. So it's still a considerably high number of people who are not vaccinated. There are breakthrough cases. It does happen, because not everybody has the same immune system and the immune response to everything. So there are issues with breakthrough cases, but it's still overwhelmingly the unvaccinated that we're seeing the positive cases in. And we will do this again, I guess, in 2 weeks, Melanie, unless events warrant a more timely response. And as she said, just feel free to reach out and send us your questions, and we will try to make sure you get the information you need.
Thank you.
Thank you, everyone.
Thanks.